There's going to be a loss to the community as from a charitable standpoint.
If we're going to be there, and survive in this market, you'll have to adapt, and it's going to be, right, you're going to have to make some tough decisions with folks.
I think it's going to hurt families, much more than help them.
I mean, what bank in today's environment is going to provide a loan to that 25-year-old who wants to open a restaurant?
Welcome to Public Policy in the Real World. I'm Olga Halaburda for the MacIver Institute. We're chatting with 3 Wisconsin business owners, restaurant owners, about the impact of the ObamaCare law on their businesses. Segment 3. In our first 2 segments, we detailed the costs of the ObamaCare law with the mandate and the taxes on these individual business owners. Now let's talk about their industry in general. It is an industry that provides nearly 13 million jobs across the country, employs nearly 10% of the American workforce. Nearly half of all working Americans got their first job in the restaurant industry. Now I'll ask you gentlemen, first big picture, how will Obamacare affect the industry from a credit and investment standpoint?
I feel that, this is not only is this going to hit the larger operators, which it's intended for, it's going to hit the smaller operators as well.
Is it going to be difficult to get loans to start up?
Yes, I believe it will.
And what bank is going to let some 25-year-old who wants to open a restaurant, or a 30-year-old who's worked in the restaurant business since they were 14 or 16, and they don't have a lot of startup money in the first place, they don't have a lot of operating capital to keep themselves in business for a year. What bank in today's environment is going to provide a loan to that person? I don't think that money's going to be there. That is going to dry up that opportunity for that young person to get started and build, like I think everyone here has done, started with a really small operation and expanded their operations. And that kind of future is going to be a lot more difficult in this environment than it has been.
Now, the Heritage Foundation analyzed Obamacare and found workers in general, not just in your industry, will be the ones to suffer most. The report states the costs of the mandate and taxes will likely be passed on to the workers in the form of reduced wages, hiring freezes, or job losses. Instead of adding more regular full-time employees, some businesses will simply increase hours for current employees, hire low-skilled and low-income workers, or opt for more temporary or seasonal workers. Talk about that specific to your industry.
Where I think it's gonna hurt us as an owner-operator when we have to go to an employee that's been working 40 hours a week and say, you're now cut to 28 hours a week, okay? And that's going to hurt us. It's going to hurt their family, but we have to do what we have to do to survive in this business. And I think you're seeing it already with the Darden restaurant chain. They're exploring the under 30-hour concept, so they'll be taking a number of their full-time jobs and creating part-time jobs out of it. And I think it's gonna hurt families, much more than help them.
The Obama administration has given out more than 1,000 waivers to the mandate. Did anybody here get a waiver?
No, I didn't get a waiver. No.
What are your thoughts on those waivers?
Well, it's unfair. It's like you're going to hand it out to your friends, and little guys like us suffer. So, no, I don't think it's right.
I'm not going to keep checking the mail.
No.
So.
Now, Pat, you had mentioned earlier that there are some unintended consequences to the restaurant industry being hit with this extra burden of the tax because the restaurant industry does so much for the community in terms of charities and fundraisers and whatnot. Talk a little bit about that. The 3 of us, and I think pretty much the majority of restaurants, all do something to give back to their communities. They hold benefits, golf outings, they help with softball tournaments, all kinds of things in the course of the year. And by losing that segment of those small businesses, there's going to be a loss to the community as from a charitable standpoint of not only money, but just
input by those businesses and their employees to help with charities and the guy, like, in both of these guys have banquet facilities, and I'm sure that they all have fundraisers for people individuals that have cancer.
In July of this year, the House passed H.R. 6079, the repeal of Obamacare Act. It passed with some bipartisan support, but it stalled in the Senate. The National Restaurant Association issued this statement, quote, "On behalf of our members, we're pleased the House of Representatives has taken this step, which is in line with our view that given the unique issues that face the industry from a workforce standpoint, the economic impact of the employer mandate and the fines associated with it will impose insurmountable costs and administrative burdens for many in this industry," unquote. It went on to say your industry supports healthcare reform, but wants it accomplished by first focusing on lowering healthcare coverage costs so it won't stifle your ability to grow jobs. Who wants to weigh in on that?
What used to be the most important employee in the place was the person that was waiting on you at the time. Okay, that's going to change. Now the most important employee in the place is going to be the one that are watching the time cards to make sure that people aren't working over the hours. And what's going to be affected at the end of the day, the customer service that you receive today probably won't be. Hopefully it'll be as good down the road, but I don't think there's any guarantees of that.
That concludes this edition of Public Policy in the Real World. Thanks for joining us. I'm Olga Halaburda for the MacIver Institute.